Namaste and a very warm welcome to Medical Tourism by Priyanka. I'm your host, Priyanka Chadha Ahmed, and today I'm thrilled to introduce our esteemed guest, who's a renowned hematologist with an impressive experience of over 17 years. He is not only a leading expert in the field of hematologist with a special focus on sickle cell disease, but over his vast experience years, he has helped numerous patients not only manage but overcome this challenging condition. A very warm welcome, Dr. Pavan,
Thank
and
you.
thank you so much for joining us today.
Thank you.
Dr. Pavan, the whole idea of this show is to make our viewers understand the latest advancements in the field of sickle cell disease and the benefits and risks associated with different treatments. So before we delve into this deep discussion, I would like you to please introduce yourself with some focus on sickle cell disease.
Yes. So I am currently heading the BMT program at Yathar Super Specialty Hospitals, which is situated in Delhi NCR, Noida region. So we have a full-fledged bone marrow transplant unit, which is looking after pediatric and adult patients. Now coming to sickle cell disease. So sickle cell disease, the pathogenesis or the pathobiology of the disease is in this, our normal red cells are biconcave disc. So in sickle, what happens? They become sickle in shape, and that causes the blockade of vessels. And all the symptoms and signs of this disease are related to this abnormal shape in the of the red blood cells. So the pathogenesis, we all know it is because of the genetic mutation, which is at position number 6 in beta globin gene of the hemoglobin. So that causes this abnormal sickling.
So, what is sickle cell disease? If in a layman term, if I ask you, as a patient, what is sickle cell disease?
Yeah, so as I mentioned, is because of the abnormal shape of these red blood cells, this causes blockade of the vessels, small vessels, that causes the main symptoms of the disease. So first we need to understand the burden of disease also. Sickle cell disease, it's a quite debilitating kind of disease, and it has its own morbidity and mortality. So I'll talk about the burden of this disease. So it's a huge burden. See, total almost 8 million people are suffering from sickle cell disease all over the world, and the annual birth rate means every year almost 5 lakh means patients of sickle cells are added every the new birth uh, with sickle cell disease.
Is
So
happening.
it's happening all over the world. The most common countries, or the countries where the most common birth rate is of sickle cell disease, is Nigeria, followed by DRC, that is Democratic Republic of Congo, and India comes at third number all over the world. Almost 45,000 children with sickle cell are born every year in India. So it's a huge burden. So total altogether, if we combine, almost 5 lakh children are born with sickle cell disease. So it's a huge burden both on the government and on the patient as well. So in fact, government of India has launched a program to eradicate sickle cell disease, and we can eradicate actually by knowing the carrier status. If we know the mother and father, if we know that they are carrier, so these children are prevented from birth. And that is the whole idea which government of India has launched to eradicate sickle cell disease by 2047.
Okay. So, what are the common symptoms of sickle cell disease?
So as I mentioned, it is because of the blockade of the blood vessels. So that causes the main symptoms is the, or we classically described as the crisis. So crisis means recurrent painful crisis. So it what happens in this, there is episodes of severe pain occurring in the bones. That is this is also called as VOCs, or the veno occlusive crisis, where it happens that blockade of vessels that causes pain. It is so severe that sometimes we need to give opioid analgesics to these kids to relieve the pain. And then other symptoms, it can affect almost head to toe. Any organ can be affected, like, and it can lead to stroke, it can lead to vision loss, it can lead to acute chest syndrome, which is typically acute, manifest as acute pneumonia or drop in oxygen saturation. Then splenic enlargement, then uh, inflammation or necrosis of the limbs. So these are all the most. So from head to toe, any organ can be affected by sickle cell disease.
Okay. So, what are the latest advancements in the field of sickle cell disease, and how can we expect them to, improve the patient outcomes?
So first thing is that when it comes to the management of sickle cell disease, so basically one thing is to manage the patient symptomatically, and the other thing is to cure the disease. So the curative option in sickle cell disease are only, I can say, two options are there. One is allogenic bone marrow transplant. It has its own complications. Then other advancement is, in terms of curing the disease, is the gene therapy. So recently we have approved, two gene therapies have been approved. Currently they are available in Europe and US, and hopefully in the future it will be available to us as well. And then later on, then next is about the management of disease, which is not aiming at cure of the sickle cell disease. There it is mostly symptomatic release. So mainly these medications are there. So conventionally hydroxyurea is there, which helps in painful crisis. Then other options are like which prevents the sickling of disease, sickling of red blood cells. That is some drugs are there like voxelotor, then crizanlizumab. So these are monoclonal antibodies and some drugs which are helpful in preventing the veno-occlusive crisis.
So, sir, also early detection of the disease helps in the better management of the cure.
See, most of the time, if we see early, because when any child is having, so basically it the when we have two genes of globin in sickle cell disease. What happens in beta globin gene? Both the genes are affected. If one is affected, usually these are carriers and they are asymptomatic. When both the genes are affected, the patients are having symptoms of that. And most of the time, if we see, uh, there are some environmental factors also involved which leads to sickling, and that causes this painful crisis. So most of the time it is easily detected, and it's not about detecting early because it's a genetic disease. The children are born with the disease, so ultimately they are going to have the symptoms. Only thing is that we have to recognize the symptoms and diagnose so that it can be managed in a very better state.
Okay. So, what is hydroxyurea? Can you please discuss what is?
So basically, hydroxyurea is a oral drug. It comes in a capsule form. Some countries it comes also in syrup formulation, so that it can be easily given to the children. It's a basically anti-neoplastic or anti-cancer drug, but not usual side effects of anti-cancer drugs like vomiting. Are usually fairly well tolerated and given for so many indications. So basically, it induces the fetal hemoglobin production. So
Acha, okay.
basically, in the symptom relief or the painful crisis are managed when we manage by reducing the percentage of sickle cell hemoglobin. So what happens? There is in carrier around 30% of our hemoglobin is sickled. In homozygous state or the sickle cell disease, around 60 to 70% of hemoglobin is sickle cell. So as we reduce the percentage of sickle hemoglobin, either we reduce the sickle percentage, or we increase the normal hemoglobin, or we increase the fetal hemoglobin. Normally by 6 months of age, fetal hemoglobin, most of the hemoglobin is fetal hemoglobin, but after that it is replaced by adult hemoglobin. So if we give some medicines, so adult hemoglobin we cannot induce, so fetal hemoglobin can be induced by hydroxyurea.
Okay.
So that is why when we give the hydroxyurea, it increases the fetal hemoglobin and the percentage of sickle hemoglobin goes down. So that's how it helps in relieving the painful crisis.
So, is it different from the blood transfusions?
Again, blood transfusion also works in a similar way. So we have a fixed percentage of sickle hemoglobin, and when we give blood, the percentage of sickle hemoglobin is, because the normal blood is given, and that increases the percentage of normal hemoglobin and decreases the sickle hemoglobin. That's how it works in relieving the painful crisis or the relieving the symptoms of sickle cell disease. So far we have discussed about hydroxyurea, voxelotor, crizanlizumab. These are medications which are help in relieving the painful crisis or the symptoms of sickle cell disease. I mentioned earlier that to cure sickle cell disease, we have two options. One is allogenic bone marrow transplant, and the second one is gene therapy. So stem cell transplant, which we are talking about, is a treatment. In this, the hematopoietic system of the patient is replaced by the donor. The donor can be even carrier, or it can be normal person also.
Okay. But it has to be in the family, like mother, father.
Yeah. So now when we talk about allogenic bone marrow transplant, we need to have a donor. The donor can be carrier. So obviously, and finding a suitable donor is best in the family, because the best donor is always match sibling donor, and the chances of finding a match donor in siblings is around one third, or 33% of patient would have a full match donor with their siblings. For other options, like those who don't have a match sibling donor available, there we have option of haploidentical transplant. Any family member and any father, mother, or even siblings can also be a haplo donor. Those are half matched. There is a different protocol for altogether. Different protocol is used in haplo transplant, and we can also search in international registry that is called as matched unrelated donor. In this, the donor is matched in terms of HLA, but it is not related to family. So that is not related to the patient. So that's why it is called as matched unrelated donor. So these are three options. One is matched sibling donor. Second one is haploidentical donor, and other one, third option is the matched unrelated donor from international registry.
So one is you're saying the carrier himself can also be
Yeah.
the donor.
So
If
so
some patient
sibling
can also be patient,
yeah
you're saying.
no. So sibling who is HLA match and he's not having sickle cell disease.
Okay.
So, because we want to replace his patient's hematopoietic system, patient blood cell with the donors. So, obviously, the donor has to be normal. But in family, sometimes it is difficult to find normal donor. And even if they are carrier, they can also be a donor. So, I mean to say that even a carrier person, if he or she is full match, they can be donor.
Okay.
Yeah.
Okay, sir. Now, the next, Dr. Pawan, what we want to understand is the have we answered these questions earlier? The SCD genetics and molecular biology impacted treatment approaches. Is this it's the same which we
Yeah,
discussed?
it is almost so. The genetics of the disease is I already mentioned that we have two beta globin genes, and in sickle cell disease, what happens is at the position number 6 in the beta globin chain, the glutamic acid is replaced by valine. This is the pathogenesis that causes the abnormal sickling of the red cells. So when both the genes are affected, it is called as the phenotype is called as SS, and when one is affected in the carrier state, it is called as AS. Sometimes the other abnormal gene in beta chain can be S beta or S beta plus. So these are other, but their manifestations or SC disease also, in which other hemoglobin abnormality is the hemoglobin C. So these are abnormalities. They also have behave like in a similar way, just like other symptoms of sickle cell disease.
So, Dr. Pawan, I would just like to repeat, what I've understood so far. That one is management of the disease, okay, which we do by hydroxyurea and other oral capsules,
Yes.
like which we give. Blood transfusion is also one.
Yes.
This is management.
Yes.
Management. But for cure is the stem cell
Cure is the stem cell transplant and gene therapy.
and gene therapy.
Yes.
And in stem cell, the donor can either be from the family, which is matched, unmatched, or we can also check the international register for some matched but not related donor.
Yeah, obviously they are not related, so these are others. So three options are there in bone marrow transplant: full match family donor, then half match family donor, and other is matched unrelated donor.
Okay, but I still don't understand the difference between the stem cell and the genetic therapy.
Yes. So now, so we have discussed. So I'll tell you for a lay person to easily understand about the treatment.
Yes.
So so basically there is a defect in the red blood, a defect in the hemoglobin, and hemoglobin is present in red cells. So, and red cell is a type of blood cells. So hematopoietic stem cell transplant or the blood cell transplant. So what we do in whole blood system of the patient is changed. So what do? We destroy the patient's blood system by chemotherapy, and we give the donor's stem cells from a normal or carrier donor, and that goes into the body and it start to work. So whatever blood is now being formed in the patient of sickle cell, it is of the donor's type. That's how. So if donor is carrier, the patient will become, his hematopoietic system will become the donor's type. Means if he is carrier, it will be carrier. If donor is normal, the blood system will be normal. So this is the whole idea of allogenic bone marrow transplant. So in this, the blood system is uh, it is corrected, or the blood system is now of the donors. We replace the donor disease donor system from the normal
Completely,
donor system,
that's
completely
changed.
replaced.
Okay, okay.
Now, in gene therapy, what we do is, so there are, now we'll come to the gene therapy. So basically, there are different methods by which gene therapy is done, and by which it is, two of these are approved also, by approved by US FDA.
Okay.
So in this, what we do, we collect the stem cells of the patient, we modify these stem cells,
Okay.
and there are various methods of modifying these. So one is, either we correct the genetic abnormalities, so this also is possible with CRISPR Cas technology. So what is done in position number 6 of globin chain, glutamic acid is this is the abnormality, glutamic acid is replaced by the valine. So what do we do in this abnormality is corrected by CRISPR Cas technology.
Okay.
So it is replaced, and we correct this abnormality, and then these stem cells are again given back to the patient after giving some chemotherapy, so that residual stem cell is stopped, and this new stem cells with correction is given to the patient. And then the new hematopoiesis or the new blood cells formed are from this corrected genetic
Okay. So the
effect.
patient's own, red blood cells
Yes.
production system is corrected.
Yes. So in a simple way,
in simple terms,
in a simple way, I'll tell you, for a lay person to understand, in bone marrow transplant, it's just like a machine. Machine has got some part which is dysfunctional, which is not working. In bone marrow transplant, we are replacing with a new part from a donor.
Yes, absolutely. Now I understand.
In gene therapy, what we do is, we take out this part, we correct it, and we again reinstall.
Reinstall it. Correct. Now,
So this is the whole idea of whole means in a simple way. This is the difference. It's not that simple, because it's not a human body is not machine.
Yes, yes,
So there are so many technologies, and after so much research, we have science has developed, and this gene therapy now we are seeing that it has become available for patient use.
So, what advice would you like to give? A lot of African patients are watching us today. So, what advice as a doctor, and you are, numerous years, in this field, would you like to give to them who are seeking treatment in India, specifically for sickle cell disease?
Yeah, so we were discussing about the management of this disease and the potential cure of this. So if we talk about, so total almost 60 to 70% of patients all over the world are from Africa. So Africa, and the third number, the birth rate also, if you see, India comes at third or fourth number. Maybe we are also having quite a good number of cases. I don't know when it will be eradicated as per the government plan. So it is mainly because of we are living in tropical area, so this is malaria endemic region, where that is why sickle is more commoner here in Africa and India also. So first thing is that I want to emphasize is hydroxyurea is very important. Whenever any patient or any is advised by their physician or by their pediatrician to use, or by hematologist to take hydroxyurea, this is very important in relieving the painful crisis. And if there is indication to go for allogenic bone marrow transplant, then obviously you have to be prepared. So adequate means properly you have to maintain hemoglobin, because this also causes growth retardation also, because hemoglobin is low, that causes growth retardation of the child. In that, it will if it is planned for future bone marrow transplant, it is always to have a good nutrition, and growth is very important. Another thing is hydroxyurea, again very important. It has to be taken as prescribed by the doctor. Then whenever you have decided to go for allogenic bone marrow transplant, it's better to do high resolution HLA typing of the patient and siblings, and sometimes in whole family, to find out the best donor, and to know the carrier status also. For that also, you should have HPLC done for whole family. And because since it is running in your family, so it's better to get tested. All the family members should get tested, so that for newlywed couple, any future, if they are planning for child, so new children, they should also be prevented from born, because this is the disease by it can only be prevented by knowing the carrier status. It's a simple test, hemoglobin electrophoresis or HPLC, by which we can know our carrier status. So these are the things I want to emphasize. And first thing is that wherever possible, it's better to prevent the disease, prevent these children from being born. And then after that, when you're deciding for bone marrow transplant, you have to take hydroxyurea as prescribed, maintain good hydration, maintain good hemoglobin if blood transfusion is required. So safe blood has to be given, and HLA typing to be done, and to know the carrier status of all the family members.
Records and tests, which are required for international patients to undergo the treatment.
So medical record means they should know their carrier status, that HPLC or as hemoglobin electrophoresis report is there. So that should be they should be carrying with them. Then HLA typing if it is done. If not done, it's better to get it done, because when sickle cell disease, it's not an emergency transplant. So sometimes there can be delay in HLA report, but it's better to know the HLA test and discuss and send the report to us, and so that we can find out the donor. That will save our cost. And it is already planned that, okay, this for this patient, this is this sibling or this brother or sister is the donor, or this father or mother is the donor, so that it will be easier for them to manage accordingly, because then they have the whole travel plan, who is coming as a donor with the patient. And plus carrier status also, that is also very important, and transfusion record, how many transfusions they have received, that is also important.
And approximately what is the duration, of stay that is required for the patients here?
Yeah. So I'll tell you. So in bone marrow transplant, the key or the important thing about the success of transplant is the age of the patient or age of the child. So if you do transplant less than 10 years of age, the outcomes are very, very good. Almost close to less than 5 years, I would say. Almost 90 to 95% success rates are there with allogenic bone marrow transplant. So now when the age increases, there the engraftment, as the age increases, the risk of rejection or the engraftment problem is there. So there the chances of rejections are more. In those conditions, sometimes pre-transplant immunosuppression is also required. Plus, in haploidentical transplant, when we are looking at half match transplant, there also PTIS or the pre transplant immunosuppression is required. So, why I am telling this? Because if suppose no pre transplant immunosuppression is required, there the total duration of a stay will be for 3 months, 1 month for bone marrow transplant, and 2 months post transplant follow up. This is the total stay in India. For those patients where pre transplant immunosuppression is required, and uh, the patients who require this pre-transplant immunosuppression, the extra stay will be for 2 more months, 1.5 months more. So total 5 months will be there for where the PTIS is required. PTIS is mainly required for haploidentical transplant and for children who are more than 10 years of age.
Okay. Now, Dr. Pawan, even in my early other interviews also, I again state the fact that we know, as all over the world we understand, that India is giving great medical facilities at best competitive rates. But if I have to see the global standards, where does India stands in terms of sickle cell disease transplant? If I have to choose a place for bringing a patient here, like I also bring patients here, why shall I choose India? Why should not I refer some other country?
Yeah. So currently, if you talk about medical tourism or India as a destination for medical tourism, first thing is that we are at par with any center in US or Europe. The quality of standard and the medical care, plus the medical facilities, technologies, everything is available. We have good doctors here in India, and we are performing and we are doing these kinds of sophisticated treatment surgeries, plus medical facilities. Whatever you talk about, everything is available with us, and it is at very affordable rate. This is another important thing. So the cost of treatment, if it is almost 10 to 20 times less what is there in US or Europe. And plus the care what is being given in India. So that is also it's outstanding. What I would say. So, plus the newer technologies, it is some technologies are being indigenously made. Like I'll give you example of CAR T cell therapy, which is for malignant B cell disorders. So there in US, it is costing almost very high cost. So here in India, it is almost I would say that almost 10 to 20 times less. So in US or Europe, if you talk about CAR T cell, will be approximately 4 to 5 crore Indian rupees. But in India, we are offering this at around 30 to 50 lakhs. So by
Okay.
this, you can compare the same means the quality of treatment and the technology, new things that are even gene therapy. Also, some clinical trials, some research are ongoing for sickle cell disease in India. So hopefully, in future, we would be having this gene therapy, indigenous gene therapy available to us. It's already for other diseases like for hemophilia gene therapy. It's already paper published from CMC Vellore in India. So there are means a lot of research work is also going on in India. So I would say that yes, it is India can be a preferred destination for medical tourism.
Understand we can have a conversation over the telecom or a Zoom call, something. Any help which we can expect from you back once the patient travels back to the country?
Yeah, so we usually when the patient is discharged and it is advised to go back to home country, so we usually give them a detailed prescription mentioning all the medications, what plus the details of all the tests which has to be monitored during follow up, and plus they are in they can have online. Usually we send when we send the patient back home, so we usually give them our contact details so that they can contact us, and online consultation also is required. And sometimes we have some countries we have associated hospitals also. When they go back, we are in direct contact with the doctors there. So that also is helpful in managing the patient and the post transplant at home care also. This is also very important, and it is possible, and we are doing it in most of our patients.
So when it comes to Africa, the ethnicity of the patient is very different from Indians. So as how well versed, we are in handling people from Africa when it comes to sickle cell disease.
Yeah, so far, I would say that the Africans will be close to Indians. So most of the time, their tolerance it is almost like what we see our Indian patient means tolerance to chemotherapy, tolerance to medications, plus their behavior and other things are also. It is quite similar. So far, we haven't had any challenge in managing those patient, and most of the time, it is easier, and they are. Usually by conversing them with also what I have found is they are almost every African patient I have come across is they are good people and they follow our advice, and they are very diligent about their medications, whatever we advise and follow up also they do it regularly.
And coming to the last question, what future advancements we can expect in the field of sickle
Yeah,
cell
I
disease?
have already advised about the gene therapy research is also going on in India, and hopefully we'll be able to offer it in a better and cost-effective way. So in future, this is going to be less costly. Right now, it is very very costly. Not many people can afford it. And regarding the management of painful crisis of sickle cell disease, so there are a lot of research also is going on. So we'll be having some medication also to control the painful crisis. Like right now, we have hydroxyurea and L-glutamine, but voxelotor and crizanlizumab. These are costlier medicines. So hopefully, in future, we will have less costlier medications available.
Thank you so much, Dr. Pawan. I think we have got a huge information from Dr. Pawan Kumar Singh in how to get sickle cell disease treated in India. And I think if you are still contemplating as to whether you should be visiting India for same, I think it's a big yes for you. So in case if you like this video, please do like it, do share it, and do subscribe it so that we can continue bringing such useful information for you in future. In case you are looking to find treatment in India, please do reach out to us at the numbers given below. My team shall be happy to help you. Your health is our priority. Signing off, Priyanka Chadha Ahmed.